Okay, here we go with the eight cost of living proposals, proposals, I should say. Healthcare insurance industry restructuring. Now, when I wrote the book CS2 and released it in early 2008, I talked about restructuring six core industries I call infrastructure industries. These are industries that we're basically captive audiences with to a point, so we really can't do anything to control them if the Congress isn't doing their job. Under that heading, I had started the list and made the model for this restructuring with healthcare insurance for all Americans, pharmaceutical industry, the tobacco industry, oil, coal, natural gas, including fracking that's killing a lot of farmland, banking and credit card, and the defense industry, right? The military-industrial complex. Now, I built a model because, again, these are industries that you really can't do anything about, and they are, some of them, getting more and more abusive. But for right now, let's just talk about the healthcare insurance industry. The first problem is we have a for-profit healthcare insurance industry for the most part. Some of the Blue Cross Blue Shield plans, okay, across the country are still nonprofit, but they've been fighting and working their way towards a for-profit status for all, not all of them, but most of them. So it's a profit center, okay? It's profit making. They have stockholders, they have executives, they have a board of directors, and this is an overhead function to the country. The cost of administering the healthcare insurance industry in healthcare function in Europe is like this, right? And here, this is what we're paying, right? And why? There's no good reason for it. Now, why do you say that, when I tell people that the healthcare insurance industry, healthcare insurance in Europe is better than ours, people go, oh, no. Some people say, well, we got the best industry, that, medical insurance, or medical system in the world. And I go, yeah, if you can afford it, but not most, but too many people can't. Okay, and every year, what do? They oftentimes go through a re-enrollment program. You have to re-enroll in your insurance plan every year. What happens? You get to pay more insurance or more money for the same or less insurance every year. This isn't rocket science, right? Now, so what I'm saying is there's no reason for us to have a for-profit insurance program. Because what are they doing? And let me tell you, the last 6 years I was in the computer industry, I worked for Blue Cross Blue Shield of Maryland and D.C., and I got a really good sense of how the whole thing works, right? Now, the reason that I say that Europe's better than ours, or the reason why Europe is better than ours, is that basically their entire medical system, right, doctors, lawyers, not doctors, physicians, hospitals, and everything, was completely and literally blown up in World War II. Different frame of reference, right? Completely blown up. So when they started rebuilding their industries, those social industries, people and things that everybody needed, they had to start figuring out how to deal with everybody because nobody had anything. Remember, we were already in the Depression, right? 29 to the early 40s, we were already in the Depression and coming out of it very slowly, even with all the programs that were put in place, right? All right? And then the war came, right? And everything in Europe was really flattened, right? So they had to restart from nothing, right? That's why they have a better system, and everybody's covered. You can be over there on vacation and have a major health problem, and they will just take care of you. It's not, and you're not going to get a bill for it, right? They just take care of you. You got to move that way over here too, like it, whether business likes it or not. And most American businesses will like it because it's going to help them with costs. Okay, so we are going to do what I call a restructuring of the medical insurance industry, involving every medical insurance industry in the country. Okay, we're going to start by creating something called a medical insurance industry consortium. All right, and what we're going to do is create that consortium, which is going to be run by business for the most part. Of course, a little help from us because we're the taxpayers, and we'll be paying part of that as we do now. All right, and we're going to take U.S. healthcare, Aetna, Met Insurance, whatever they are, however many that are left, all right, will become operating divisions under that consortium. We will then, just as we had to do with General Motors when Obama took over and we had to save GM, we will then be able to basically retire their executives and their boards of directors, whatever blankety-blank golden parachute they've got, one time, and they're gone. We can put somebody else in place to manage those companies as we merge them all together. And over a period of 18 to 24 months, I think we will have a very, very simple, very easily to run, everybody's enrolled once type of a system, and it'll be much more efficient, and we will move very quickly to having insurance for everybody. That pretty much sums it up. And there's a lot of write-up on this under, again, Proposal 22. It's the healthcare insurance restructuring in my book. I think that's pretty much what I had to tell you about that, folks. So we have to do this. Remember, insurance system, insurance industry, what do? They enroll people. And they only need to enroll people once, okay? They control costs. They watch for fraud, okay? That's what they should do, right? And that's all they do. It's an overhead function. They should not be making, remember, the cost of providers, the actual doctors, technicians, some hospital costs, okay? They go up every year a certain amount, depending on how it's controlled. But why do we have to pay another 5 or 10 or 15% profitability for running an insurance company? It doesn't make sense. It's just the way it's always been. And just because it's been that way doesn't mean it needs to continue. Because remember, insurance companies' objectives is to minimize claims. They don't want claims. They're doing whatever they can to minimize claims or to get rid of people that are high risk, right? So we will take care of medical insurance industry. We'll deal with the VA system. We will deal with Medicaid and make us much more efficient and get our country healthier than it is right now. And we will, last but not least, we will begin to work on preventive medicine. Okay, our medical system right now is like a auto shop where you go in and you get your car fixed when it has a breakdown. You either do preventive maintenance on your system or you don't. Right now, the medical insurance industry, by and large, does not care if we take care of ourselves. They pay a little bit of lip service to it, but they don't push it. They're like a repair shop. The medical insurance industry and the pharmaceutical industry have had their time, and now it's time for them to step up to the table and pay their fair share. So that's it, and I hope this makes sense to you, these 8 proposals on cost of living, and I think this is the type of thing we got to do to control costs. With really, when you look at those, what I just went over with those 8 proposals, those proposals will not cost the taxpayer that much to implement. It'll put an awful lot of money back in the economy and your pocket. Thank you very much. Take care now.